Group 22 here to teach you about psoriasis. What is psoriasis anyway? First of all, there are many different types of psoriasis, but for class purposes we will be discussing the most common form, plaque psoriasis. With that said, just what is plaque psoriasis? What plaque psoriasis is a chronic, relapsing inflammatory disease of the integumentary, or skin. Normally, new skin cells, or keratinocytes, grow, reproduce, and are shed approximately every 14 to 30 days as new cells are generated to replace old and dead ones. This obviously does not occur all at once, with every single cell being sloughed off in that time frame. Normal skin cell replacement is staggered, allowing for the skin to remain relatively smooth and consistent. In those people who develop plaque psoriasis, there is an alteration of the normal growth, death, and replacement cycle of skin cells. Instead of cells being replaced every 2 weeks to a month, cells are replaced in a span of 3 to 4 days. What causes this to occur is a specialized cell of the immune system. These specialized cells, known as T cells, normally fight off invading pathogens. But in the case of psoriasis, these cells begin attacking normal, healthy skin cells. During this attack, chemicals are released by the attacking cells, telling the skin to begin reproducing new skin cells at an accelerated rate, resulting in the raised, thickened skin plaques that are a hallmark of this disease. In addition to this, the body's inflammatory response is triggered, causing pain, redness, and localized swelling in and around the plaques. Along with the classic hallmark plaques, a yellow discoloration can sometimes be seen under the nails. Typically, psoriasis is diagnosed based on the signs and symptoms of the disease or presence of plaques on the skin without further diagnostics. So who is affected by psoriasis? Between 1 to 4% of the U.S. population and approximately 125 million people worldwide. Men and women of all ages are equally affected. However, men are more likely to have more severe forms of this disease. Research also indicates that Caucasians are at a higher risk for this disease than other racial groups. Though incurable, there are many therapies that can help alleviate or stop symptoms, such as trigger avoidance. Triggers of psoriasis are many and can include, but are not limited to, mild trauma to the skin, such as scratches or even tattoos, sunburn, chemical irritants like detergents or harsh soaps that contain added perfumes or dyes, some medications. Check with your doctor to see if any medications you are using along with a plaque psoriasis diagnosis may exacerbate your condition. Finally, psoriasis is known for its comorbidity disease links, including an increased risk for Crohn's disease, certain cancers, non-alcoholic fatty liver, metabolic syndrome, cardiovascular disorders, as well as depression. We thank you for your time and hope that you now understand a little bit more about plaque psoriasis.
Created using Powtoon.